Hello and welcome to Knowledge Synthesis 2. So what I want to talk to you about today is just a review of what you learned in Knowledge Synthesis 1. So that's really putting together the entire nursing process. So if you guys remember, when we look at general test-taking skills, we want to remember a couple of key things. We want to make sure that we're always identifying the topic. Remember, your stem of your question is your report, and you always need to figure out when you receive a report what's the most important thing you're going to do first for your day. Then you want to go through and you want to select your answers by eliminating answer choices. As you know well, a lot of times on nursing style questions, all 4 answers are right. So you can't just look for the wrong answer choice or for the right answer choice. You have to eliminate the wrong answer choices. Once you identify your topic, you don't want to go to the background information unless absolutely necessary. So if you say your topic is hyperglycemia, then don't pick an answer choice that's related to hypertension just because the patient has a history of hypertension. Don't read into the question. Those phrases, what if, yeah, but, they need to be eliminated from your vocabulary because as soon as you say what if or yeah, but, then you are making up your own question and you're no longer answering the question the teacher has asked you. And you want to make sure you're answering the question that the professor wrote because otherwise you're not going to get the right answer. And lastly, you want to make sure you're thinking about your outcomes. It's not a matter of just reading the words on the screen. You want to think about if I do this action or if I ask this question, what will actually happen or what information will I gain? And the strategies that you learned last semester all build into making sure you're covering all of these key test-taking strategies. So if you remember, you want to go through 5 steps when you're going through a nursing style question, especially if it's priority. This semester we're going to go through alternate question types, but last semester we really stuck with the multiple choice priority questions, and you always first find your topic, then look for assessment versus implementation. Lastly, look for physical versus psychosocial, looking at your ABCs, and then finally thinking about those outcomes. If you struggled with this last semester, I want to suggest that you make a chart like this. This will force you to go through and make sure you're actually using all of the steps in the critical thinking process. First, you come up with your topic. Then you think about assessment versus implementation. If you still have answers left, you go to physical or psychosocial. Still have some answers left, you go to ABC. And if you still have answers like that, after that, you make your decision based on your outcomes. So the first step is that you need to identify the topic. Now, just like when you receive a report, most people aren't going to say, here's the #1 thing you have to do for the patient. What you actually have to do is take all of the information you've received about the patient and you figure out what's the #1 thing you need to do. That's called finding the topic. And as a result of that, when we're writing test questions, we're not just going to say, here's the topic. You have to take all of the information and figure out what's the most important thing. The best way to do this is to cover all of your answer choices, focusing only on the stem of the question. Figure out what the question is really asking and narrow that down to 2 to 3 words. But if the topic's unclear, remember you can always go to your answer choices and use the concepts in the answer choices to help you figure out what are those topics. So if by reading the stem alone you can't figure out the answer choices, then you're going to uncover, or you can't figure out the topic, then you're going to uncover the answer choices and read those answer choices for clues. Remember, you're not trying to answer the question because you don't know what the topic is yet. But once you identify the topic from the answer choices, then you get that down to 2 to 3 words, and now you're ready to move on to step 2, assessment or implementation. So let's see what this would look like. A client during the transition phase of labor reports lightheadedness and a tingling sensation in her fingers. Which action should the nurse take next? So when I take a look at this, I'm going to start with my last sentence first. Which action should the nurse take next? So I know this is priority. And then from priority, this could really be a couple of different topics. It could just be about the transition phase of labor, or it could be about the symptoms the patient's having, this lightheadedness and tingling sensations. I'm going to look at my answer choices to try to figure out my topic. Now, when I look at these answer choices, I'm not trying to figure out what's right or wrong, because I don't know what my topic is yet. I'm just looking at the concepts related. So if I take a look here, ask the client to breathe into a paper bag. Well, I usually have patients breathe into a paper bag because they're hyperventilating. So #1, my concept is hyperventilation. #2, remain with the client. My concept, psychosocial support. Number 3, obtain an arterial blood gas. That would be respiratory distress. And number 4, start an IV. That would be dehydration. So now I want to go back to my symptoms, lightheadedness and a tingling sensation. Well, that could be a symptom of hyperventilation. Hyperventilation is more important than psychosocial support, so that's not going to be my topic. Respiratory distress. Well, I don't really have respiratory distress here. I just have someone who's lightheaded and has a tingling sensation in their fingers. So that's almost too extreme of a topic. And I definitely don't have any issues that concern me with dehydration. So now I know my topic's hyperventilation, and I'm ready to move on to my next step. What I would do at this point in the chart is I would write topic priority hyperventilation. And now I know that I need to move on to assessment or implementation. So when do I assess? I want to make sure of a couple of different things. Remember, an assessment is anything you're going to gain information from, but it has to be a valid assessment. So when you're thinking about a valid assessment, you have to make sure it makes sense for your topic, and you also have to make sure that it provides you with new information. So to determine your assessment, you're going to read each answer choice to determine if it's an assessment or an implementation. If there's a mixture of assessment and implementations, you want to go back and validate the assessments. If the assessments are valid, then you're going to eliminate the implementations. If the assessments are not valid, then you're going to eliminate the assessments and move on to step 3 with either all assessments or all implementations. So when you look at it, you want to just determine a couple of things. Do you have data in the STEM? Does the answer choice duplicate that data in the STEM? You want to determine, does that provide you with new information? And does the situation actually require an assessment, or do you have enough information already? So I go back to my question, ask the client to breathe into a paper bag. That's going to be an implementation. Remain with the client, implementation. Get an ABG, assessment. And start our IV saline, that's going to be an implementation. So I should start with number 3. Obtain the arterial blood gas. But for everyone who's hyperventilating, do I need to get an ABG for them? No, that would be way too much of an intervention. So number 3 doesn't make sense for my topic. So that means I'm now going to eliminate number 3 and hold on to my implementations 1, 2, and 4. So now going back to my chart, what I'm doing is I'm writing implementation, implementation, assessment, implementation, and I'm going to cross out that assessment because I said it wasn't valid. Same thing here, you can see that we've crossed out number 3. Because I have 3 implementations, I'm now ready to move on to Maslow's. Maslow's is physical or psychosocial. Again, you're going to prioritize physical well-being over psychosocial well-being as long as the physical answer choice is valid, as long as it's related to your topic. So the things you want to look at is you want to determine if the answers are a mix of physical and psychosocial. If they are, prioritize those valid physical over your psychosocial. And once you're done validating, if you only have physical answers left, then you're going to go on to step 4, your ABCs. But if you only have psychosocial answers left, then you're going to go on to step 5, outcomes, because we don't need the ABCs if we only are dealing with psychosocial answers. So let's go back to our question here. So I've already decided that I've gotten rid of my assessments. So now I'm going to do physical or psychosocial. Number 1, ask the client to breathe into a paper bag, physical. Remain with the client, psychosocial. Start an IV of 0.9% saline, physical. So I'm going to try to validate at least one of my physical answers. If someone's hyperventilating, does it make sense to have them breathe into a paper bag? Yes, absolutely. So now I can get rid of answer choice number 2, my psychosocial answer. So what I would do in my chart now is I would write physical, psychosocial, physical, and I would cross out my psychosocial answer. Now because I have 2 physical answers left, I'm moving on to ABCs. Respiratory takes priority over circulatory. Circulatory takes priority over all other body systems. Remember though, it has to be valid. You have to have a respiratory issue in the topic to make that your priority. So our ABCs are airway, breathing, and circulation, but if you remember, we're actually going to prioritize these as respiratory, circulatory, or other. So if I take a look at our question, breathing into a paper bag, that's a respiratory answer. giving IV fluids, that's a circulatory answer. I've already validated my respiratory answer, so I know I can now eliminate my circulatory answer. And in theory, at this point, you can now stop. You've eliminated the 3 answers. You have strong justification for eliminating those 3 answers. So number 1 is your answer. But what I want to do really fast is I want to show you what if we went on to step 5. So step 5 would be moving on to our outcomes. I can now see I've eliminated 2 and 3 at an earlier stage, and I've now eliminated my circulatory answer. So respiratory is the only one left standing. So same thing here, I have only my respiratory left. So now I move to outcomes. Don't just select the answer that sounds right, you want to select the answer that has the best outcome. To do this, you want to identify why each action is performed, determine if the outcome of the determine the outcome of each answer, and determine if it's desired for the situation. So if I were to use my question for that, I would go through and I would say, if I look at this, and I mix these up, but up here, my respiratory answer is going to be returns carbon dioxide. So I would actually be throwing out my circulatory, and my outcomes would be correct. And here's what our final answer would be. The last thing I want to talk about today is the self-reflection piece, because a lot of this class is about remediation, whether it's remediating your critical thinking skills or whether it's remediating your ATI. Self-reflection is defined as active, persistent, and careful consideration. These are those intellectual and affective activities that individuals engage in to explore their experience, which leads to new understandings and appreciations. So when you look at self-reflection, this is a process that takes time. You want to pause for a moment. What's working well for you? What's not working well? Think back to last semester. When were you successful on a test? When were you not successful on the test? What was the difference between those 2 testing scenarios? You want to keep doing what's working and think about how you can change what's not working. So let's say you had this question. You care for a client reporting a lot of discomfort after receiving pain medication. The client states pain is 8 out of 10, heart rate is 68. The heart rate before medication was 80. Something's not right here. So you're pausing, you're self-reflecting, you're saying there's something not right here. You want to say what's working? Well, the heart rate has gone back down to the pre-med level, so we're back in our normal range. What's not working? The client's still in pain. How can you fix that? Now you're going to prioritize. So you want to think about all of your different options. Maybe you could reposition them. Maybe you could give a different medication, offer cold packs, or need to assess again. And you're going to prioritize what you would do over that. Today's nurse has to utilize reflection as a part of the clinical reasoning. This is something the NCSBN, the people who make the NCLEX, have actually said. The NCLEX is intentionally an anxiety-inducing test because they want to know that when you have a really hard patient load, that you can still make strong clinical judgment decisions, even under a lot of anxiety. Clinical reasoning, however, enables you to provide clinical care in a manner that's safe, accountable, and professional, even if you are under a lot of stress or anxiety. So when you're looking at self-regulation, you want to reflect about every test that you take, whether that's for this class or any class that you're in. And you want to also make sure you're reviewing and remediating the questions whenever possible. That's what office hours are for. Go to office hours. You want to reflect on every test before the next test to learn what you did to improve what you will do. You should learn something, take something from every test that you take and say, okay, here's what's worked, this is what I'm going to continue, here's what didn't work, how am I going to change that? So how do you reflect on a test? What was your testing environment like? Were you feeling anxious? Did you identify any patterns? And how was your timing? Did you have 10 questions left with 5 minutes to spare? Or did you finish the test with 30 minutes left and maybe you went a little too fast? In terms of the testing environment, was there noise around you that was distracting? Did you have your phone on, especially for those at-home practice tests? Did you check any other websites? Did you drink at the computer desk? Did you eat at the computer desk? Did you find yourself looking around? If you discover that during a test that your ceiling really needs to be painted, that means you're distracted during the test, and that's something you want to take note of. Things to implement is whenever you're taking a test that's not in one of our classrooms, take it in the library or a quiet location. Don't have the television or phone. Don't multitask or be available to other distractions. No food, drinks, candy, or gum while testing. You're not allowed any of these on the NCLEX, so you can't bring them in then. So don't bring them into your study time now. And it'll emulate the testing experience in order to build your stamina for test taking and reduce anxiety. Did you feel anxious? Were you anxious before the test even began? Oh my gosh, I didn't study enough. Or all these people are talking about all these things they know and I didn't study that. Did you feel nauseated before you started? Good sign of anxiety. Did you find yourself sinking in your seat as the test went on? Good sign of anxiety. Were you looking around? Anxiety. Could you feel your heart rate go up? Anxiety. Or did you have difficulty focusing? That would be anxiety too. So you want to practice. The more comfortable you feel, the less anxious you'll be on test day. Eat something like crackers, very mild, before you begin. Find a positive mantra that you can repeat during the test. Do relaxation breathing. Visualize calmness. Hum in your head, not out loud, your classmates would kill you. Or do a guided meditation before you take the test. Do you find that you have a set of incorrect answers when you test? A set is 4 or more incorrect answers in a row. This is not a result of your knowledge. This is usually a result of your stamina or your anxiety. What was going on during that set? Did you hit a select all that apply that was really hard and drove you nuts, and then the next 4 you missed because you couldn't stop thinking about that select all that apply? Identify what happens during these sets. When you're studying, take a planned break at intervals that correspond with your set. So if you realize that you tend to get 4 or more questions wrong every 20 questions, take a break. Take that break in your chair. You can't get up during the test, but you can sit back and hum to yourself in your head on test day. Take a restroom break or eating break when you're studying to help reduce that anxiety. On test day, sit back, close your eyes and breathe. Take 6 to 10 seconds. And try to be very alert to any loss of focus so you know when you need to take a break. Did you change your answer? I know there's a lot of you out there. How many times did you change your answer from correct to incorrect? What patterns are you able to identify? If you usually change them from incorrect to correct, then keep doing it. But usually people change it from correct to incorrect because they are not correctly identifying or because they're not trusting their gut and they start to put what-ifs into those statements. Changing answers implementation. If you're changing answers from incorrect to correct, keep doing what you're doing. If you're changing them from correct to incorrect, take a practice test and force yourself not to allow yourself to change any answers and see how you do. And remember, you have the ability to answer the questions correctly the first time, so you shouldn't need to change your answers. Do you have a timing issue? Do you see a correlation between how long you stayed on a question and whether you answered it correct or incorrectly? Do you run out of time? Things to do if you have timing issues is once you eliminate an answer, don't go back to it. Ask whether the information you are thinking about is actually in the question or is it a what if. Note how often you know the correct answer but you do not choose it. Trust your gut. Do not select an answer because it's familiar to you. Select it because you've eliminated the other answers. Do not automatically select an assessment. You have to make sure it's valid. And do not automatically select respiratory. You have to make sure it's valid. And lastly, you want to remediate every question. Reflect and remediate every question to identify what you do well and identify what you need to change. And the things you want to remediate are, did I get the topic correct? Did I go through and did I follow the critical thinking strategies? And do I know the content? So these are the things that we want to bring into you for your reflections and your remediations throughout this course. Everyone have a great day, and I will see you soon.